Congestive heart failure is a leading diagnosis in elderly patients being discharged from the hospital every year. There's really two types of congestive heart failure. There's one that's a very enlarged, weak heart muscle that cannot pump the blood throughout the body, and you develop fluid buildup and symptoms of shortness of breath and edema. And then there's another type called diastolic heart failure, where your heart muscle actually squeezes normally, but it doesn't relax normally. And as a result of that, the fluid backs up into your lungs and leads to congestive heart failure that way. Heart disease, coronary artery disease, is very common in the United States. It's the #1 killer in the United States, and that is probably the leading cause of congestive heart failure. Blood pressure is also very, very important as a leading cause for diastolic heart failure. The new goal of blood pressure is 130/80, so you really need to make sure you go to your doctor regularly and have your blood pressure checked on a routine basis to make sure you have good controlled blood pressure. People that have poor controlled high blood pressure over time will lead to developing congestive heart failure. If you have a history of heart failure in your family, obviously this gets your attention, so you really need to look at ways to lower your risk of developing the same thing, say, your family has. Healthy lifestyles, keeping your weight under control, exercising routinely, eating a heart healthy diet with low sodium intake. All these things are helpful. Sometimes people have sleep apnea that's untreated. Getting that treated is very helpful too. The most common symptoms starting off are going to be shortness of breath when you start trying to do activities that normally you were able to do before, but now you're giving out quicker than usual. You also may start noticing some swelling in your feet, and you may also notice at night when you lay down you can't get your breath. You have to sit right back up because your breath gets short and you end up propping up on pillows to breathe better. Another symptom is you may actually go to sleep, but you wake up in the middle of the night where you can't get your breath. That's another symptom of heart failure. Sometimes at night people have a cough or some wheezing at night when they lay down. This is another sign of heart failure. So sometimes people have increase in abdominal girth where their stomach starts swelling. That can lead to it, or their appetite becomes poor. They have real fatigue. These things are easily treatable with medications, but early diagnosis is very, very important. You need to get to a cardiologist or your primary care provider early if you're starting to have symptoms so that we can act on this very quickly. And there's some really good medications out there. The beta blockers such as Coreg and metoprolol succinate are really good to try to improve the pumping function or the ejection fraction on the heart. There's ACE inhibitors and ARB drugs that are out there that we use for congestive heart failure also. We're very fortunate to have a new drug called Entresto that's actually improved survival and decreased readmission in patients with congestive heart failure. All these medicines have been shown to improve survival. The fluid medicines that people take is really for symptomatic relief. They don't necessarily like Lasix doesn't improve survival. Now the aldosterone antagonist like aldactone has been shown to improve survival. Interestingly, in Mississippi we have a high number of African Americans. There's a medicine called Bidil, which is a combination of hydralazine and isosorbitol dinitrate that actually improves survival in African American patients with congestive heart failure.